Hello, my name is Kristen, and I am going to be going over metabolic therapies as my choice for my alternative medicine therapy presentation. Some other common names for metabolic therapies include nutritional therapies, um, Garrison regimen, and Kelly therapy. These, of course, are not an all-inclusive list, but they are some of them that you will see in research. Metabolic therapies can be applied to a wide variety of diseases, and they can help in their management. However, the focus of this presentation will be on the patient with cancer. Metabolic therapies include certain types of diets, vitamins, and mineral administration, as well as detoxification. It's believed that these together can help rid the body of toxic cancer products that gather together in the liver. Metabolic therapies are based on belief in the importance of detoxification, which is thought necessary for the body to heal itself. The concept of metabolic therapy originated from Egypt. It was believed that illness and death occurred due to putrefaction in food in the colon. Some indications for use is in the cancer patient, prevention, treatment, detoxification, and rejuvenation. Advocates for metabolic therapies claim that a healthy diet and practices include coffee enemas, herbal laxatives, and immune augmentation, detoxify the body and allow for it to heal naturally. Of course, there are some contraindications, side effects, and adverse effects, as you can see up here. So to start with the contraindications, according to Sloan Kettering, the American Cancer Society urges patients not to seek treatment with potentially hazardous metabolic nutritional therapies, including the metabolic therapies I discussed earlier, the Gerson Manner regimens. According to Sloan Kettering, excessive use of coffee enemas can cause infections, dangerous electrolyte deficiencies and imbalances, and death, especially when it's combined with fasting. Flu-like symptoms are a side effect, as well as nausea, vomiting, diarrhea, weakness, dizziness, intestinal cramping, fever, muscle aches, pains, rashes, and of course, nutrient deficiencies. Some adverse effects that researchers have seen are rectal perforation from the enemas, seizures, sepsis, electrolyte imbalances, rectal burns, hypokalemia. So a culture that uses this and is actually known for administering these therapies, especially to our culture, to the cancer patients in the U.S., is the Mexican culture. In Tijuana, there is the Garrison Clinic that is known for this treatment. The Garrison treatment aims to counteract liver damage with a low-salt, high-potassium diet, coffee enemas, and a gallon of fruit and vegetable juice daily. The clinic's use of liquefied raw calf liver injections was suspended in 1997 following a sepsis in a number of patients. So health teaching for our patients is vital. You know, if you have a patient that has cancer and you are admitting them prior to surgery or prior to chemo administration, it is important to know if they are on these metabolic therapies, and teaching them that they need to do the research on the potential prescribing physician that they may be going to or they are already going to. They need to discuss these interventions with their oncologist. They also need to discuss this diet. They need to add this diet and the supplements to a medication list. God forbid they are out shopping and they fall or get hurt or pass out, and they get rushed to the hospital and they don't, and somebody looks at their medication list in their wallet, and this is on there, and it's a potential side effect to something that they're taking, a chemo pill that they're taking, or whatever they are receiving at that time. Another important thing to teach the patient is to monitor for side effects and adverse effects, because they're going to be the people that are experiencing it, and they need to know when to tell the doctor or when to call their doctor's office or when to seek evaluation. And also, they need to consider their comorbidities. With drinking this much fruit juice, is that okay for a patient with kidney disease? Is it okay for them to have certain amounts of potassium, or not to have potassium at all? I mean, of course, all of these things are going to impact the rest of their bodies. Next is the study that I did some research on, and it was conducted to determine how to prevent metabolic therapy use in the cancer patient undergoing treatment. The methods that were used was the data was collected from patients who were in the hospital, and the researchers reviewed their diagnoses, the medication list, and the metabolic therapy use. And the results showed that 29% of the 820 patients that they reviewed, they reported use of metabolic therapies that were not prescribed by their physician. So this is a growing trend, or a growing therapy that we need to be aware of. Caucasians and patients over age 60 were the principal users of the metabolic therapies during treatment. Modular vitamins were the most frequently reported additive, and following by botanicals and biologics and mineral supports. And to conclude the study here, as health professionals, we should become more aware of these alternative therapies that our patients may be using or considering to use. And in conclusion, when patients feel a loss of control over their healthcare, like when they receive a diagnosis of cancer, they are more susceptible to looking for alternative care that may or may not be beneficial to their health. It is important as healthcare providers to educate our patients on the pros and cons of these alternatives. It's also our duty to know about them and to know enough to educate, while still encouraging them to have control over their health decisions, but really educating them how dangerous they can be, especially when they're overindulging. And as you can see my references, thank you so much.